The three generations classification, and I want your opinion. The first generation with no pulse train, so it was the thesis of Serge 40 years ago, you see. No pulse train, so I think it's not a good idea to have an IPL with no pulse train nowadays. So what's your opinion, Carlos?
The first generation, you mean? Well, the problem is that the IPL came from the dermatologist application. So talking about the eyes and the preocular area is another issue. So I think it's important to move new generations. So those who have an old machines, of course you can adapt and adjust the setting, but I think it's not a good idea. I think it's better move to the new generations just to improve the efficacy and also the security. Remember that the IPL can produce some birds.
Yeah.
So this is not a joke. And that's important, especially when we try to combine the dry eye treatments with the aesthetics. So the IPL is not an easy matter to manage. So I think we need new technologies that adapt the energy, how to deliver the energy in a safe and effective manner. So I think it's critical, the new ones.
Okay, I think, Rolando, you don't work anymore with that.
How many people do cataract surgery here? We have some cataract surgeries? Okay.
Most everywhere.
Let me ask you this question. Is phaco good? Yeah, phaco takes the cataract out, right? Is a lot of phaco good? Is too much phaco good? You use enough phaco to do the job that you're doing. One of the first laws of physics is use only enough energy to get the job done. There's a belief in IPL for new people that are using it, if a little energy is good, a lot of energy will be better. And that's not the case. Anybody who's been doing IPL for a long time knows that you can get burns, you can have adverse events. What I found is, there's a right level of energy. It's just like phaco. You want to use just enough to get the job done. You don't want to use more because you get adverse events on the corneal endothelium. It's the same way with the meibomian glands. Too much energy stifles the glands and they don't work. So we looked at that. So we looked at giving, if 12 joules is good, let's give 16 and see if we get a better, faster effect. And actually, too much energy, you get no effect. So you want to use the lowest amount of energy. Now, in that, with a pulse train, what you're able to do is space out that energy that you're giving. So in phaco, what are we doing in phaco now? We're pulsing our energy. We're not just going, we're going bursts to do our surgery to limit the amount of phaco that we're doing. And that's the way to think of IPL, is that we're pulsing that energy so that we can get the reaction that we want on IPL. Why we need pulse trains? Because you can't do dark skin if you don't have pulse trains.
It's the next question.
So you're limited. If you don't have pulse trains, you're limited to a type 1, maybe a type 2. But with pulse trains, being able to increase thermal relaxation time for that energy to diffuse out without burning the skin
I agree.
Is the ability with these pulse trains.
So this new ocular probe, Serge, do you use that? Not
no,
yet?
Not yet, but I'm eager to use it. As you see, it's a probe that goes onto the main probe, and that will focus on the lids. So you can use the same protocol as you use on the Luminis.
Okay, so it's an incoming project. So single pulse is not as effective, so we answer to this question. And Rolando evokes the problem of dark skin. I think you can't use an IPL without trained pulse in dark skin. So do you agree? Carlos, do you agree with that or not?
Yeah, we were talking about the importance of the pulse strain. I think it's critical. Even
Okay.
yeah, it's just
So working with no pulse train IPL nowadays is not recommended.
yes.